So in terms of the indications for robotic knee replacement surgery, they're exactly the same as conventional knee surgery. So patients who have established arthritis with clinical symptoms of pain, reduced range of motion, functional limitation, that tends to have not responded to non-operative treatment, or non-operative treatment has been tried previously, and then those treatments such as physiotherapy, weight loss, injection treatment have now run their time and haven't given the functional benefit or therapeutic benefit that that the patient would have required, and therefore surgery is indicated. And really, robotic surgery has the same indications for conventional knee replacement surgery, but has added benefits, and allows, as I'll come on to, allows a different philosophy to be employed in terms of knee replacements. Conventional knee replacements use jigs, alignment jigs, so that we can place the knee replacement in a set position, which is essentially a position that 50% of the population lie in. So therefore you have extremes on either side where that knee replacement isn't in the position that's functionally suited to them. So we find that with conventional knee replacements, there are a proportion of patients, a small proportion of patients, but enough to be to warrant the use of robotic surgery, but these small proportion of patients who they're not happy with the conventional knee replacement. And one of the thoughts is that by using robotic surgery, we can actually perform a more customized knee replacement that takes into consideration a particular individual's alignment and tension within the knee. And the robot allows us to, by taking lots of data from during the operation, it can allow us to simulate what the knee replacement would look like in that individual patient, and we can then set those parameters so that the robot allows us to make specific customized bone cuts for that patient, and allows the implant to be seated and implanted in a position that is absolutely individualized for that patient. And with that in mind, and with that degree of specificity and precision, we're seeing better results in terms of functional outcomes after surgery. So the advantages of robotic knee replacement surgery is that it allows for customized implantation of a knee replacement and precision surgery. And therefore, with that in mind, we're seeing patients who are having better functional results after surgery, and then hopefully in the sort of long-term data, we'll be seeing better longevity of the implants as there's more precision implantation. There aren't any disadvantages with robotic knee surgery. It might take a little bit longer in terms of the operation time, but generally it's around about 10 to 15 minutes, which really doesn't compromise any part of the patient pathway afterwards. We use a few drill holes to allow for the computer array to sit on in the bone. There can be a risk of fracture from that, but it's very rare for that to happen, and certainly with just two pins in the femur and 2 pins in the tibia, it's very unlikely for that to happen. And I have to say, although it's been documented, I haven't had any cases of that happen in my practice. So in terms of using adjunctive imaging, the advantage of the robot-assisted surgery that I use, which is the CORI system, is it doesn't need any preoperative imaging, just plain X-rays, which are just for my benefit. The robot itself takes all its information from the time of surgery. So all the other systems require either a preoperative CT scan, which is added radiation to the patient and also added cost as well, or MRI. But with the CORI system, all the information can be gleaned from the surgery itself. So robotic surgery the use of robots is a relatively new concept. They've been on the market now for about 6 or 7 years. Previously, there was computer navigation, but didn't have quite the same level of dynamic control intraoperatively in the operation. You could plan your surgery preoperatively and then implant the implant as per your preoperative plan. The robotic surgery allows you to take in dynamic real-time information from the surgery, whereby we're recording how much tension there is in the knee on either side of the knee and through flexion extension. So we can really customize the knee replacement for that specific patient. And that's really where that sort of evolution has come from. In terms of the latest advancements, the robot I use has evolved from what was a Navio to now the Cori system, which essentially allowed for an improvement in the computer processing, much quicker data. The computer can process much more data and really gives even more, a computer, it is only as good as the information it can process and the information it receives. So I really think that the Cori system is the most up-to-date and really the most effective in terms of the robotic surgery and where we're going in the future. So in terms of risks with the robotic surgery, I mean, the risks are very similar to conventional surgery. The adjunct, I suppose, is that we use drill holes to fix our arrays on, so that there's a fixed point within the bone that doesn't move, and the computer has that reference point that it can always refer back to. We use drill pins for those fixations, 2 in the femur, 2 in the tibia. There is a risk that a fracture can be encountered from those drill pins. I have to say I haven't had that complication, but it has happened with other surgeons, and I don't think there's anything that can be mitigated for that. But like I say, it's a very, very low risk of that. And then in terms of knee replacement surgery in general, risk of infection, we use antibiotics to mitigate for that risk. Risk of stiffness after surgery, and I think in terms of the robotic surgery, there's less encountering of stiffness, because we're putting in the implant in that sort of customized, personalized method using the robot. So stiffness is less, but not completely abolished. And then other risks as well, risk of blood clots. We give blood thinning medication to reduce the risk. It's a mechanical joint, so it can wear out, but in theory, the precision implantation, customized nature, means that hopefully wear is reduced, and we'll hopefully see that over time. As I mentioned, the robotic knee replacements are only relatively new phenomenon of about five years or so, 7 years, and so we haven't really got the data for long-term results. We'll only have that at the sort of 20-25 year, but I would imagine with that sort of precision, we'll be getting better functional long-term results with less wear over that time.